Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. All right, I have a very good list of questions, so let's go ahead and get into it. All right, number one. How do I get an accommodation for extreme anxiety before my AAPC test? Again, I am not certified with the American Academy of Professional Coders. I am certified through the American Health Information Management Association. If you need to get an accommodation through them, contact them directly. They're going to be the ones to be able to tell you what you all need to do and what is required. But I will say this. If you have extreme anxiety now about taking a test for medical coding, consider this. As medical coders, we go through a lot of changes. Every single year, there is an update, there is a change, there is something new added, there is something taken away. We are in a constant state of change. If this is anxiety inducing for you, then I would suggest, and not that I'm trying to discourage anybody, because believe me, I am far from it, but if it is something that is anxiety inducing for you, I would consider looking at maybe something else, because we are constantly in a state of learning, of growing, of changing, of more and more and more every year. So I'm just letting you guys know that this is something that does occur. And with extreme anxiety, I'm not really sure organically what it is, because it could be a myriad of factors for different people. But one of the things that causes anxiety is being unsure and unknowing, okay? The best way to alleviate that is to study hard, and know what you're doing. Because the more you inform yourself and the more knowledge you have, the less scared you're going to be, and the less anxiety filled that you're going to be. The more you get deeper into medical coding, the easier it's going to be for you. But you have to be willing to apply yourself so that you don't suffer from this anxiety. And that's just my opinion. But that would be one thing that I would say. And I'm just speaking truthfully. And I, of course, don't want to offend anybody. And of course, I don't know why I have to make that disclaimer, but I do. Because I certainly would never, ever discourage anybody from doing what they want to do. I'm just letting you guys know that this is a fact about medical coding. All right, next one. How hard is the test to get the certification? I can't really answer that, because it's going to depend on you. What is difficult for you may not be difficult for me. What is difficult for me may not be difficult for you. Again, you're going to have to go through the program if that's what you want to do, and you have to take the test. Clearly, these tests are not meant to be easy tests. This is not an easy field. That's why we get paid what we get paid, and do not ask what we get paid, because you can look it up on the Department of Labor. The only reason that I say this is because every place in the US is going to start their coders off at a different rate. Some people get upset with me for this, for not saying how much coders make, but you can look it up. You can Google a medical coder's salary like that. So I shouldn't have to answer that. But I'm just saying that if that is what is, if you think that the exam is too hard, or maybe somebody's telling you that it's too hard, it's going to be up to you. It's the individual, okay? That's why I say studying is so important, and knowing your guidelines, and knowing the book, and knowing your coding conventions. These are all very big things. So arming yourself with as much knowledge as you can before you go in to take your exam is really important. And one other thing that I forgot to mention before, when I studied before I took my certification exam, I'm a CCA, a Certified Coding Associate. I didn't use a practice exam book. I didn't. There are so many practice exam books out there. Had I known, I probably would have used a practice exam book, but I literally went through the school, went through my program, and took my test. Not long afterwards. But I didn't use a practice exam book. There are practice exam books out there, so take advantage of those. and test yourself and see where you are. That would be a good barometer. Not that those questions would be the questions on the exam, because I don't know what questions are on the exam, but at least if you use the practice exam book, and if you set it in a setting like you would be if you were taking an exam, like if you give yourself the allotted time for whatever test that you're sitting for, it'll tell you your allotted time. And if you sit for that particular amount of time, and you make sure that you're in an area like in your home or somewhere, and you are setting it like it's a real test, then that way you can see, can you finish it in time? Where do you get stuck? You can find these things out on your own. Just be sure to set yourself up for success. That would be my advice on that one. Next question, do providers use a 3M encoder? It depends on the facility, because every facility's electronic medical record is different. So, but they do have coding software built into their electronic medical record. So that's essentially what they're using. 3M encoder is a lot on the medical coding side. So the medical coders are going to be able to use the ones that are, the standalone or part of their program for medical coding. So they do use it, sort of. It is built into their electronic medical record, so they don't see the same things we do. So that's my answer on that one. How often do providers do their own code selections? It's going to depend on the facility. It's going to depend on the setting. So for inpatient professional services, where I work, the providers do not select any of their own codes. They don't input anything. They just document, and it's up to the coders to abstract. So they're the ones that are literally selecting all the codes and applying all the codes and the procedures. So it's going to depend on what setting they're in. This is why, if your providers are selecting the codes, that you have to get a good working relationship with them, so that you can make sure that they are selecting the correct procedures and diagnosis codes. All right, next question. What should I do about a provider who reads queries but doesn't respond? In those instances, you have to take the bull by the horns. You have to go to the provider and you have to talk to them, because there are going to be providers that you're going to notice that do not like email, that would rather you be in person with them. And for those providers, they're going to need a little bit more finesse. So, like I said, when it comes to email, it's really difficult. And I know sometimes, like this, in the setting that you're in, it may not be very time efficient if you went to them. But if you gathered up some of the queries that you do have and take it over to them, like maybe when they have a free moment, or maybe just kind of like walk through there and see if they're free, then you can just stick your head in and start talking, because maybe that's what they want. Every provider is going to be different in the requirements that they have for their coder. That's why you have to talk to them and make a good shot at trying to get a good relationship with them, because it's going to be beneficial for both of you in the long run. Okay, so my advice on that one is go to your provider if they're not responding to the queries, okay? And let them know why it's important. You can take your references with you, take a book with you, take an article or whatever you're using to back up your argument, take it with you, so that way that you can explain to them, this is what this query means, this is why I need this information, okay? Number 6, how can I help a provider to understand why I'm querying them? Which went right into what I was saying before. A lot of times they don't understand these medical coding rules. That's what they say. I don't understand these medical coding rules. So you do have to show them where you're finding it in the book, where you're finding it in the guidelines, where you're finding it, wherever, your official guidance. So that is important, because it's going to be Greek to them. I mean, they're not going to understand, because we as medical coders, we speak differently, we talk differently than they do. Same thing with them. I mean, they're providers. They speak differently than we do. So it's all about opening those lines of communication so that they can start to understand. It may take a few runs to get them, but eventually you'll be able to get them if you take the time and you spend it with them. Okay? Because it's a good investment. Just saying. Next one. How does a CPC exam work? Is it like taking the SAT where I have to go somewhere on a certain date with a proctor, or can I take the exam at home? No, you cannot take the exam at home. Even I know the CPC, you have to go to a testing facility where you have a date and everything to go. So you can have your books. I mean, these are open book tests. You know, you do have to use your book to do the coding. There is no encoder, so there is no, easy route for taking these tests. You do have to use your book. Okay, so you can find out more information about the particular test that you are going to be taking on the website, either ahima.org, ahima.org, or aapc.com. Make sure that you go there. And this goes back to where I was telling folks before to do your research and make sure that you're looking up these resources. Okay. Next question. Is a coding job like school? Do you sit at a computer and look up codes in a book for scenarios the whole time? Is there more to the coding job? I have a lot of videos on a day in the life of a medical coder. This talks about the things that I do. I am very hands-on with my providers, so a lot of the things that I do are technically unconventional, and for some people, I mean, it's a regular day. Some people don't do the things that I do. Some people don't spend the time on education with their providers like I do. It's all going to depend on you. But there's a lot of things that I do during the day. It's not just about medical coding. It is staying educated for my facility as far as like staying on top of my HIPAA certification, privacy, and safety and things like that. So it just depends on your function and what you're doing. Different coders have different responsibilities. Some are just responsible just to code, and others, like me, take initiative to go do education with providers and make sure that I talk with other coders as well when they have questions. So it really is going to depend on what you're doing and what your purpose is there. Some coders will do billing. Some will do other tasks around their office or facility. So it really all depends. That's why when you go apply for these jobs, make sure you're asking all the questions. And I did do a video about what questions to ask when you are interviewing for a medical coding job. Okay, so next question. And okay, it is, would a normal coder's job be to do a certain amount of tasks and then you're done, or just to work on coding until the time is done for the day? So if every coder has a quota, okay, now that's a quota of like however many encounters they have to code in a day. Or if you're inpatient, how many records you have to go through. It's going to be different for every facility. Every facility is going to have a different standard of what they need in a daily basis. And let's just say, for example, you're like me and your quota is 90 per day, 90 encounters. I have to code 90 encounters a day in order to be compliant with production. Does this mean that when I hit 90 encounters that I can stop for the day? No. There's going to be days when I don't hit 90 encounters because I can't. I literally can't because of, a chart was really difficult, or there was a provider that was maybe changing things up and I had to talk with them. There's a lot of reasons why. Yes, you can deduct time out of your production for like meetings, staff meetings and things like that in education, online education. There's a lot of different things that you can take out time for. However, if you are going slower on production because you have difficult charts or something else, you have to dig and it just takes more time, those are the days that you're not going to be able to produce as many records. So on those days where you can produce a lot, and let's say you get done with your 90 or whatever your quota is for the day. Some people is 120. Mine just happens to be 90 because I'm in a specialty clinic. For me to do 90, and it's still early in the day, I still have plenty of day left. I would continue to work. I mean, I continue to work and push and finish as many encounters as I can. I've done days where I've done 150 encounters. I've done days where I've literally done 175. Is that flying? Yes, but there are some days when I can get to that because depending on what's happening in the clinics. When I did the neurology clinic, I had some days where they had group classes. So I was able to produce a lot because it was a lot of the same thing. And that helps me on those days where I have to take the time and really dig and look and work with providers that maybe have strayed and fallen off. So it just depends on, what the deal is that day. So that is my advice. If you finish early in the day, doesn't mean that you need to stop and pull out your phone. You still need to continue to work because using that time wisely and completing more encounters will up your average of your production. Okay, so like I said, on those days when you just can't get through them quickly, you'll have that excess to fall back on. You'll still be compliant because they're not going to look at you each and every single day. What they're going to do is average out the days and average out the hours and see if you're still compliant. If you're compliant, then you're good. If you're not compliant, then they're going to be looking at you like your production's a little low. What's going on? If you have a really good supervisor, they'll be watching you the whole time. I've had instances where my boss did tell me, Blue, your production's a little low. And I was telling her at the time that I was having a lot of distraction with my former partner. And because she used to like to talk a lot. And the more I would try to work, the more she would talk, or the more she would make noise or whatever. And she wasn't really trying to do a lot of quiet time where I need quiet time. And even with headphones, it still makes it a little difficult. So I did have that issue. And I did tell her about it, and of course, nothing was done, but I did tell her, that's the reason why. I said, this is not a normal behavior for me. I don't normally not hit quota, but this was the reason that I was not able to hit quota. So, she was like, okay, and there have been times when I have been, I was recovering from surgery. I had my gallbladder taken out, and I was still able to meet production standards. Amazingly enough, so that's not normal behavior. That's not a normal pattern, but she did ask me. So if you start to slip on your production, they are going to ask you just to find out what's going on. And if it's that you're slacking off and you're talking too much, then that will be a wake-up call. So it just depends. It really does depend on, what you want to do. But my goal is to always exceed the standard because I feel that that's what my providers deserve. Is it somebody that's going to work hard and push to make sure that their encounters are being touched 100%, and that, yes, while they may be picking the correct codes and everything looks good, that I'm still touching 100% of their encounters because they deserve that. And on the instances where they're missing something and I can pick up extra things because they didn't pick it up, then that's good for them. And that happens quite often because there's times when they don't know that they are eligible for credit for something else. So that's just, that's my story on that one. But yeah, if you always maximize your hours in the day. Never try to slack off. If you are not feeling up to snuff or whatever, make sure that you are doing something that is going to be productive. Okay. And if it means going and talking to your providers, or putting together education for whatever, then do that. But always make sure you're working towards the goal of getting better and improving your clinic and your facility, because it all starts with you. So that's it. So that'll wrap up Q&A Tuesday today. But if you have any other questions, please let me know. I will be filming tomorrow. I'm working on a topic idea right now. So I will be filming that, and I will let you guys know when I will have it up. So I will go ahead and close this up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next video. Bye!